This segment of Lakeside Today was sponsored by the Buckeye Health Plan.
And welcome to a Wednesday edition of Lakeside Today. And look who's over here in Studio B. Fresh from Studio A, Danielle Wiggins joining us. It's so good to see you.
It's always great to be here with you.
Yeah.
Always great to weather and traffic on another level.
I know. It's like we spend the day together as it is.
Right.
So, you know, we're getting into our health and wellness segment and talking about diabetes, which many of you can relate to. Your risk for diabetes, detecting symptoms, all of that stuff.
Yes, and here now to share some tips on how to improve health and to prevent diabetes is Dr. Brad Lucas from Buckeye Health. Thanks for joining us.
Thank you. Thanks for having me.
Now, Dr. Lucas, diabetes runs in my family, so I'm very familiar with it. But for those who aren't, can you explain it a little bit and let us know why it's bad for us in Ohio?
Diabetes, as an obstetrician who's been in Ohio for a long time, as a medical director, has helped a lot of individuals in Ohio. I've really seen how diabetes affects Ohioans. About 12% of Ohioans have diabetes. It's chronic disease, life-changing, and if you kind of don't recognize it, don't take the steps to prevent it, you can really get in trouble. It can just affect your whole body in a lot of different ways. So important to see your doctor, have a good relationship with your doctor, and if you feel like you're at risk, to make sure you're having the types of checkups to look for that.
Well, I'm glad you bring up risk. Is it fair to say who's most at risk for diabetes?
Yeah. Poor diet, sedentary, overweight, you're going to put yourself at risk for what we call type 2 diabetes.
Okay.
There's probably 8 million Americans who have type 2 diabetes and don't realize it. There's about another 85 million Americans who have pre-diabetes. It means they're just about there, and their body's starting to do some of the things that'll take you down that road. We often hear about, we associate diabetes with sugar, your sugar being high, and what that means is not just sweets, but we think sweets, simple sugars, things in our diet that aren't so healthy. As some people, as they're more sedentary and they gain more weight, they don't manage that blood sugar in their bloodstream very well. And as that's elevated, it starts to damage our body in a lot of different ways. It can affect our vision, give us a number of different diseases that affect our vision. It can affect the nerve supply throughout the body. It's the big blood vessels, small blood vessels. In a complex way, things just don't quite work as well. We get a lot of kidney disease, heart disease. The longer you have diabetes, you're twice as likely to die of a heart attack or stroke than somebody who doesn't have diabetes. So
how do we
get you everywhere. Get off the couch, be active, watch your diet. I think a lot of folks have some idea what a healthy diet means, but kind of always work on improving your diet. And if you're overweight, just a 7% weight loss, say if maybe should be around 130, 140 pounds, but you're 180, 190 pounds, you lose 15 pounds of weight, then you're going to pretty much prevent yourself from getting diabetes. So weight.
Well, thank you so much, Dr. Lucas,
We could
for
go on
joining
and on.
us. Yes,
Such great information.
And of course, for more information, just go to BuckeyeHealthPlan.com. And you can also call 1-877-505-4904.
Doctor, thank you.
Thank you.
Thank you so much again.